emissions, risk monitoring, not only in health sector, but other environmental determinants of health. They insist that they need risk monitoring. Other ways is use of efficient communication and awareness raising, use of early warning systems in order to ensure prompt diagnosis and management of the climate risk, the use of disease surveillance in order to understand emergence and the trend of diseases, and also use of diverse supply networks and stockpiling in order to ensure sustainability of medical essentials regardless of existence of climate change risks. However, although we know there are those measures, most of these studies have been done mostly in developing countries, and there are limited studies in Africa and Tanzania in particular, and therefore we know less on what is happening in our health facilities in adaptation and mitigation of climate change. So this is what prompted this study. WHO framework of 2013 has got 10 components which guide the way healthcare systems can achieve resilient to climate change impacts. For this study, I used two components, which is component 4 and 6, which strengthen the role of healthcare facilities, especially in integrating those 4 strategies in order to achieve climate resilient in those healthcare facilities. One of them include integrated disease surveillance and early warning systems, adaptation of current infrastructure and technology in supply chain, promotion of new technologies, and environmental sustainability of health operations. So we use these components in order to assess to what extent these climate action are actually implemented within the facility in those 3 sites. The study was conducted in 3 districts, and they were chosen because they have documented to have those climate extremes, which is flood, drought, and landslides. And in each district, two wards were selected, and in each ward, 2 villages were selected. We collected data by using focus group discussion and survey, and we conducted 6 focus group discussions with health committee members, and we know those health committee members, they start from the national to the local level, so we began from the regional level to the village or street level. The survey was implemented to health facility leaders at regional and district hospitals, health centers, and dispensaries. Quantitative data, which were from the survey, were analyzed by using descriptive statistics, by using SPSS, and qualitative data from focus group discussion was analyzed by using content analysis. This presentation will present more of quantitative data, but I will be bringing some issues in the qualitative as time permits. So to start with integrated disease surveillance and to what extent they implement indicators around that parameter, as you can see around those 3 cases, at least we can see progress in Same, and it is followed by Babati, but we see Kilosa is lagging behind, especially in the use of early detection tool and the use of climate and weather information to assess risk and outbreak of climate sensitive diseases. So why is this information important? Because it informs policy and public awareness and also foster proactive approach to health risks. Monitoring greenhouse gas emission and health risk. Monitoring was assessed by using different indicators, and overall we can see there is good progress in climate-related determinants of health, which are water, air, and food across those 3 cases. But greenhouse gas emission and review identified capacities in vulnerability assessment were not popular in all sites. So what does it mean? That means there is monitoring of impact of water quality and quantity, monitoring air quality, monitoring food quality, but around greenhouse emission and to see how capacity identified in vulnerability assessment has been evolving, is not done in those sites. Communication is essential in order to guide people to make informed decision. And generally, we see there is some progress in implementing communication plan, especially in Babati, and some initiative in Same, but there is low progress in Kilosa except on climate risk. It is important to highlight this one because we see communication has to be packed in the way that it provides comprehensive information which can guide adaptation and the mitigation of the climate change. Adaptation of current infrastructure technologies in supply chain. Generally, we see there are some progress, but it's not encouraging across all those three sites because we can see the area which has got the high percentage across those indicators is the one with just above 50%, and it was on improvement plan for ensuring health service delivery during extreme weather events. But if you compare them across all those three sites, we see Kilosa and Babati is lagging behind, especially on specification for technology and selection of product and the processes for service, which can ensure service delivery during the climate crisis, and also retrofitting health facilities to ensure they are climate resilient, as well as improve plan for ensuring health service delivery during extreme weather events, especially this is very relevant in Babati. Promotion of new technology, we see there are several indicators there which guide how exactly technology has to be promoted for climate resilient. And we see across those indicators, SAME is leading in adoption of technology-driven climate action, with some efforts in Kilosa and Babati focusing more on renewable energy and sustainable technologies. But other areas like adoption of environmental sustainable technologies, which are suitable for harsh conditions, and the use of new technologies which can strengthen climate resilience and reduce carbon emission was not reported in Kilosa and Babati. Environmental sustainability of health operation. We can see Kilosa show no progress across all indicators, which indicate limited or no initiative toward climate action, especially on environmental sustainability of health operations. SAME appear to be more active in promoting environmental sustainability within health sector, followed by Babati with some effort in specific areas, which transition the health sector transportation system to low carbon greenhouse gas emission, as well as reduce the use of inhaler and anesthesia. Generally, we saw there are some initiatives across study sites, although but there is no comprehensive integration of the climate change across those indicators, although we have seen some areas are better than others in order to reduce greenhouse emission and adaptation to climate change impact. This implies that the study sites are not well prepared to adapt to existing climate change and reducing greenhouse gas emission in health facilities. So there is the need for awareness raising and capacity building to health facility leaders in order for them to be able to champion action to mitigate and adapt to the impact of climate change in health facilities. Thank you so much.
Thank you. Naomba to project I start? Thank you. My name is Annette Mena, coming from TGNP, which is a non-government organization. I'll be talking about health workers' understanding of climate change impact on health system under the same project funded by WHO. Our introduction. The impact of climate change has refined the new roles of health workers from their traditional ways of working. But the reality on the ground shows that the knowledge gap due to lack of climate health curriculum has forced workers to be unprepared to respond to the climate change. This gap limits the health institution's capacity to address climate-related impacts, including carbon emission reduction. Therefore, implementing a comprehensive climate health curriculum is very crucial for developing an agile